Child trafficking could really happen to anyone, and it is never the victim's fault. Predators are very skilled at being coercive and manipulative at getting children to believe them and falling prey to their plans. The definition of child trafficking is the recruitment, coercion, transportation, transfer, harboring, or receipt of children under the age of 18 for the purpose of exploitation. Some risk factors for these children are isolation, emotional distress, homelessness, poverty, family dysfunction, single-parent households, mental illness, substance abuse, learning disabilities, developmental delays, childhood sexual abuse, lack of social support, and lack of education. Because the primary way to prevent this from happening is educating the population at risk, which is the patients and in adjunct with them, the caregivers, it is very important to advocate for grants and programs that provide the education needed to recognize the signs of human trafficking and how to avoid the situation entirely. Doug Jones introduced the Bipartisan Human Trafficking and Exploitation Prevention Act of 2020 to provide incentives and training for students, teachers, and parents to prevent the occurrence of child trafficking. Jones said that thousands every year are trafficked across the state of Alabama, and this bill will help to stop this atrocity. Not only will education for parents and children be very helpful at preventing human trafficking, but also education for healthcare providers and other staff to recognize the indicators for potential victims. Some examples of indicators are the predators putting their brand on the victims, and this can look like a lot of things, but I'm going to explain some examples of what you would see. So this might look like a tattoo in the same spot on a child's body as others, so compared to other patients who also have been victims to sexual child trafficking. And this tattoo would usually be on the neck or lower back. And another indicator of this might be seeing a poorly dressed child who might appear homeless in nature but is accompanied by an adult or a caregiver who is well dressed and seems to be someone of upper class in nature, socioeconomically wise. So it's very important for the healthcare providers and for the nurses and any other staff to recognize these signs of child trafficking. And the only way to do this is by educating them. And as I said before, with grants and federal programs brought into thought by the bills that we can advocate for, this can be a real thing. So by advocating for these federal and state programs, we can teach these warning signs to the healthcare workers, and there's going to be a better chance of recognizing the signs of human trafficking and putting a stop to it wherever we can. Thank you.